We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your host, Norm Volsky. And we are thrilled to be joined by our esteemed guest, Danny Seidman, who is the founder of DHS Advisors. Danny, welcome to the pod.
Norm, thanks for having me. Glad to be
Wow.
here.
First guest I've ever had on either Bending the Trend or Digital Health Heavyweights that brought the gloves. And just for our viewers, we are not fighting each other. We are both fighting against rising healthcare costs. So, we're on the same team. And, we're going to have some fun here. So, Danny, you're a doctor by background, and you've moved into advising employers on how to, manage their healthcare spend. So first question is, what are some strategies that you have offered your employer clients that have worked really, really well and you'd recommend to others?
Yeah, so Norm, great to see you again. Glad to catch up for a bit. And love the gloves.
Yeah.
So I think, you bet. So from a global standpoint, I think, advice that everybody gets, if you're fully insured, you really got to look at being self-insured first and foremost. After that, looking at direct primary care, installing that not as an add-on luxury benefit, which is great, but also really integrating it into a plan.
Yep.
And
reason
all the things
to be very important, which you probably agree with, is if you can't control the referral, you can't control cost. Once you go into a big health system and they have PCPs that work for that health system, they have pressure and incentive to refer to high cost areas of that health system. Mm-hmm. And a lot of times they're recommending the right setting of care, or care, but sometimes in the wrong setting from a cost standpoint. They're really only looking out for your clinical best interest. Financially isn't very much top of mind. So that's the reason primary care is so important for employers, because if the doctors that are doing those PCP visits are not hospital affiliated, they have no conflict of interest.
Absolutely. Yeah, I think really well said. And I think the perception of the employer without DPC is, people aren't being navigated, referrals aren't being guided, people are just out there doing what they're doing. But that's not really the case. As you said, if people are seeing a hospital-based PCP, they are actively driving everything into the hospital system. And so the goal of the employer, along with installing DPC, should be to reverse that trend and say, okay, we're going to have the physician guide the care, but it's going to be to high quality, high value services, imaging, labs, et cetera.
Yep. Couldn't agree more. Any specific vendors that you've recommended your employer clients, or even they already used that, they were working with before you got involved, that you would just say, hey, these are vendors that are doing great things clinically. And oh, by the way, there's some really nice value and cost savings associated with these things as well.
Yeah. So, full transparency, I was running an on-site clinic for one of these vendors for many years. So I do have to give a shout out to Salta Direct Primary Care. I think they do a great job with the care experience and working with employers to provide primary care, urgent care. But, there's a lot of groups that do that now nationally at scale. Anyone who interfaces with HINT, I think that's really good for employers with multiple locations, multiple states.
Christine recommended HINT on this a few weeks ago. So I'm hearing a lot about them.
Yeah, so HINT and Apley, especially for the larger groups, but I think both of them are really good at saying, hey, here's one contract for you, employer, versus you having to negotiate with 20, 30, 40 DPCs if you're a multinational. So I think those are good for that type of solution. And a Salta-like company or Plum Health is also big in our area. Metro Detroit is where I'm coming from. Better for employers that are more geographically focused.
Okay. Any others that are point solutions for specific conditions or specific disease states?
It's funny. It's hard not to get point solution fatigue sometimes because there are so many options out there. One I really like is green imaging. I don't know if anyone's shouted them out yet, but it's basically a direct contracting across the country for advanced imaging. So things like MRI and CAT scan. Costs going through the health system can be 5 or 10 times what green imaging can provide. I think they do a great job. They have published case studies as well.
They typically work with a lot of TPAs, if I'm not mistaken. There's a vendor at the enterprise level that works with big jumbos called One Imaging. They've got dozens of Fortune 1000 companies saving millions on their imaging spend. It's a very similar model. There's some intricacies, there's definitely some differences in the
Mhm.
employee journey, but both, like, if you're not going to go with one, you should go with the other, because something's better than nothing for sure.
Yeah, and there's a very clear and quick ROI on those solutions. I think both you can, text your imaging order to the website. It makes it super easy. Both can integrate on the plan side, which I love. Green, I was actually looking at with a client because they're able to work without integrating, which is a nice way to kind of pilot it. You kind of don't get the full ROI, but at least you get the experience. You get to know them a little bit more low risk. So I appreciated that.
Cool. Very good.
Yeah.
And what are some of the results that would cause you to share that, like, recommendation with others with
Mhm.
primary care? Like, what are some of the things you see when you're like, hey, when a really good direct primary care offering is there, here's what we're seeing in the data: cost savings, clinical quality, you name it.
Yeah, well, my favorite thing, again, putting the physician hat on, is the clinical quality. I got to present at a conference our data from the last 5 years for our near-site and on-site clinic network. We saw a 30% drop in urgent care visits, a 40% drop in ER visits, and
Mhm.
almost a 50% drop in readmission. So people who had been admitted to the hospital, they come out, we jump on that. Say, hey, let's make sure your meds are right, make sure you have your follow-up set. Readmissions are disastrous, obviously for the human involved, but also for the plan and the payer. And so we were really proud of those results.
I think it's so cool that again, you still practice, but you felt like you could make a bigger impact and a larger scale impact on the, benefit side than just, care 24/7. I think that's really interesting, and I totally see, like, why that allows you to make a huge, huge impact. Is there anything that doesn't exist from a vendor standpoint that you're hoping in the not too distant future it does, because you're seeing a gap and you're hoping there's an entrepreneur out there that hears you and says, oh, I should start a company because that's solving a real need?
Yeah, and it'd be great. So I'm trying to think a few steps ahead so I could really use this in about 6 or 12 months. But I'm thinking of like a constrained AI model that can kind of bring together a whole host of these point solutions and direct contracting and basically serve as the infrastructure for a care navigator. And it would be maybe it already exists and you're going to tell me about it, but
I did not pay you to say that. All I'm going to say is that.
okay, fair enough. We'll talk later. But yeah, so I think that I could really use something like that, or more so. Let's say you're a large employer and you're hiring the care navigator. How do they know, the up-to-date information on which imaging centers is included by green imaging? That can change. Who's on the plan, which facilities right now have up-to-date cost information. Like these things, usually people have a binder and it's out of date. And like if you had a constrained AI system to manage all this, care navigators would be so much more efficient. So I look forward to using a tool like that one day.
Well, I love it. Well, Dr. Danny, thank you very much for joining us on Bending the Trend. Sounds like employers need a DPC strategy. They need, COE, imaging, other areas to be able to, limit their spend and get better value for their dollars. And excited to hear all the amazing things you do with your clients and your patients to increase quality, improve outcomes, and decrease cost. And thanks for all you're doing. Really appreciate you.
Yeah, you bet, Norm. Thanks for having me on. Great to see you.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.